We will open up or begin the Grand Forks County Commission meeting on Tuesday, February 16th. Please note for the record that all commissioners are present. Commissioners Falk, Engen, and Knopf are on via Zoom, and Commissioner Rost and myself are here at the county chambers. So the first item on the agenda is the approval of the minutes.
Madam Chair, I would make a motion to approve the minutes.
Wonderful. The minutes have been, the motion has been made. Is there a second to that motion?
I'll second it, Tom.
Okay, assuming a roll call vote, all those in favor of the motion signify by saying aye.
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 Opposed, same sign. The minutes are approved. The next item on the agenda is the approval of the order of the agenda. Does anyone want to add anything to the order? Do we have that one on there from Northwood?
Madam Chair, this is Dave.
Yes.
I do have a topic to add, but I can do it in committee reports or now, or at some other time. It concerns the NDHC hospital complex in Northwood, looking for support. I think I did send all of you the documents that cover this, so you can decide where you want to put it.
Actually, I think it would be fine if you do committee reports, Commissioner Engen.
Fine.
Okay, wonderful. Does anybody want to make a motion to approve the order of the agenda?
I'll make a
So
motion.
moved. Good.
Okay, and the second, Commissioner Knopf, thank you. And the second?
I'll second it, Tom.
Okay, thank you. Assuming a roll call vote, all those in favor of the motion signify by saying aye.
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 Opposed, same sign. The motion is approved. Then we have item number 4, the approval of the consent agenda. Would anyone like anything pulled? Bills, employee status change overtime, the 2021 financial report?
I'll make a motion to approve the consent agenda as presented.
Okay, is there a second to that motion?
Second, Dave.
All right, is there any discussion? If there is no discussion, assuming a roll call vote, all those in favor of the motion signify by saying aye.
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 Opposed, same sign. The motion is carried. The next item on our agenda is the county board appointments. Ms. Nelson, I'll turn it over to you.
Madam Chair, members of the commission, we have some boards that we need to appoint various people to. The first one is the Grand Forks Planning Commission. And we had one applicant and he's currently serving, and I did put out a request to the board to see who they would like to fill that position. And they were in favor of the currently serving member, and I believe his name is Steve Wasvik. So if we could have a motion to appoint him, that would be great.
Okay, does someone want to make a motion to appoint Steve Wasvik to the Grand Forks City Planning Commission?
Madam Chair, I'll make that motion.
All right, do we have a second to that motion?
Second, Dave.
Okay, Commissioner Ross already made that second. Commissioner Engen, thank you very much. Assuming a roll call vote, all those in favor of the motion signify by saying aye.
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 Opposed, same sign. Then we have someone in the Grand Forks City Planning Commission.
Yes. And the next one we have is the Emergency Management Board. We only had one applicant. The individual that's currently serving, I believe her name is Michelle Riccozzi. And the board is in favor of reappointing her. So I need a motion to reappoint Michelle Riccozzi.
Madam Chair, I'll make a motion to reappoint Michelle Rakosi to the Emergency Management Board.
Okay, we have a motion. Does someone want to make a second to that motion?
I'll second it, Tom.
Okay, assuming a roll call vote, all those in favor of the motion signify by saying aye.
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 Opposed, same sign. Then the Emergency Management Board position has been filled.
Madam Chair, members of the commission, no one applied for the County Planning and Zoning Board. I know they are not all that concerned because they have enough members on that board, so they still have a quorum. But if you know anybody that's willing to serve on that board, they could be anywhere in Grand Forks County to be on the County Planning and Zoning Board. And the last one is the County Weed Board, and it's an unexpired term, filling the term of Herbert Wealthy. And they had 2 applicants, and I know that the board made a recommendation for one of the 2. And as soon as I get in here, I'll be able to tell you who it was. And maybe you know already too.
I'm happy with you.
It isn't. So you saw what I had scanned in. There were 2 applicants for the weed board. And of those 2, the weed board actually made a recommendation of one of the 2 of them. You have that?
The names are Mr. Landman and Ms. Van Laer, Marcia Van Laer. Those are the 2 applicants. They recommended Samuel Landman.
Yes, for the weed board, it's Sam Landman and Marcia Van Laers. And I believe, did they recommend Mr. Landman?
They did.
Yes, they recommended appointing Samuel Landman.
Before we get to a motion though, could I ask a question, Madam Chair?
Yes.
Is there anyone from the weed board present in the room?
There is not.
Okay. When I look at these 2 resumes, Mr. Landman's a farmer and has some background in all of that, of course. But then Ms. Van Laer is a graduate from NDSU, of course, with a degree in crop and weed science and has worked as a sales agronomist for over 20 years. That looks like a pretty good resume to me, and I'm wondering why it is that she was not given consideration. You know, we don't have to go with the recommendation of the board, but of course, that's why we asked them to give us one. I wish there was someone here to tell us why they chose Mr. Landman. Any thoughts, anybody?
I don't think
Madam
there's
Chair.
anybody from the weed board present to be able to make that comment. Unless you would like to, we could table this particular nomination and get information from the weed board before we move forward. Would you prefer to do that, Commissioner Engen?
Well, I hate to hold up anything, but it just seems to make sense that since we have the appointing authority, we should, if something looks a little unusual, we have someone well qualified, I'd like to know why they didn't select her. It may be that she's presently working with Gowan Chemical with a selling company. So maybe that's all there is to it. But
Well, but based on this information, I think that we will table this particular appointment and we will wait until next commission meeting and get more information from the weed board. Okay, then moving on, the next item on our agenda is public health. So do we have Deb Swanson available?
Madam Chair, members of the commission, this is Debbie Swanson. Can you hear me okay?
Yes, we can.
Okay, I'm going to start with the data portion and share my screen if possible. So bear with me as I work through this technology. I believe it will knock out others' screen sharing. So are you able to see the dashboard?
Yes.
Okay. Thank you for allowing me to present this information that was compiled for the Health Officer's Dashboard today by Michael Dulitz and Nerese Nicolette from our data team at Grand Forks Public Health Department. I'm not Michael Dulitz, so when it comes to answering questions, I may not be as articulate as he is at explaining all the data. But I just wanted to point out a couple of the slides. You can see on this first slide that our dashboard is in the yellow. We were at green for one day last week when our cases were at a almost all-time low, and we didn't have as high of percent positivity as we do currently, and the change was less. But there are some bright spots in that we're still continuing to test, albeit at a slightly lower rate, and our hospital capacity remains at green, although the inpatients have ticked up just a little bit lately. But there's a number of factors that go into that. I won't spend a lot of time on the scales, but as you can see, there are still comparisons here between the other major metropolitan areas related to the new case rate comparison per 100,000. And then, of course, our doubling rate. And this is probably what most everyone is most interested in learning about today, which is our vaccination rate. So as you recall, we set a 60% vaccination rate to look at how we might achieve that herd immunity through vaccination, as well as people that have past infection, knowing that vaccination rates are what are probably the most important element here to ensuring that the pandemic transmission stops. For Grand Forks County, for one dose coverage, we're at 15.3%, and for two dose coverage at 8.5%. If we look at the eligible population, though, this is 16 years of age and older, it's at about 10.5%. So we're doing well, and as could be expected with our vaccination plan for Grand Forks County. There are some comparisons that include what we call the MSA region, or Metropolitan Statistical Area, which includes Grand Forks and Polk counties. And because vaccination is happening there as well, you can see how that has a little bit of an impact. And then on the bottom there, our total population is a little bit higher. So the very bottom bar, I should have mentioned that in the previous slide, includes the total doses fully vaccinated in terms of numbers of people, and then the total number of people. So our quest to 60% as we compare to the state, Burley, Morton, Ward, Cass, and Grand Forks. Grand Forks is doing well. We're at the top of the leaderboard here compared to the state and some of the other major metro areas. So I think whatever strategies we're using seem to be working, but of course in public health, we always are looking to be better and to protect more people. And then once again, this is that 60% area comparison. And now we have Manitoba, South Dakota, North Dakota, and Minnesota. And once again, we have a slight lead there over South Dakota. And then the cumulative vaccination rate per 100,000 population, once again, for those major metropolitan counties, Grand Forks is at the top there. With a total cumulative vaccination rate per 100,000. Just a little bit above the state, considerably above Ward County. And I won't spend a lot of time on this slide. It's a pretty busy slide, but we did break it out, or I should say Michael and Nerese broke it out by the age categories for 70 to 79 and 80 plus. And we do this because these are the age groups that we know have the greatest impact in terms of having COVID disease and in poorer outcomes. And we're doing certainly better in that. This is a slide that shows the weekly progression. So you can see we started out low and we've been growing quite a bit. And while we may be doing better overall than Ward County is doing really well in the age category of 80 plus. And then this is the percent of population with first vaccine dose by age group. So obviously we've been focusing on those first that were 75 and older. We're currently at 65 and older without any, 65, all people 65 and older, regardless of their health conditions. We moved to that just this past week, recognizing that we had some capacity to serve more people. Cumulative deaths, you can see there, we have had 73 in Grand Forks County. That's less than our peer counties. Could very likely be related to our health officer's order for masking, as well as good hospital care and a few other factors. But what I really want to focus on is this SWOT analysis, or strengths, weaknesses, opportunities, and threats, and what is the bottom line. So for the past week, we have a really high vaccination rate in our county, and we did reach the green level on Wednesday of last week on the health officer's dashboard. But some of our weaknesses include, as I mentioned, an increase in local hospitalizations due to COVID, a significant increase in new case incident over the past week. I spoke with our lead for our contact tracing team this morning, and she said they received 12 cases, which will be reported out tomorrow. There may be more, but that's what they received in an assignment. And she said they haven't had that many cases on any one day assigned to our team for a little while now. And the state continues to receive a low allocation of COVID-19 vaccine. We could give more, and we could allocate more out to our community partners if we had more vaccine, but our state is trying to be equitable in allocating it across all the counties. We have been using a large point of dispensing vaccination event to continue for the time being. We believe that does help us efficiently allocate the doses provided to Grand Forks County, but we're constantly evaluating that. And then our opportunities, because we are now focusing on vaccination efforts, and while our cases were a little bit lower, we could use the contact tracing that we have in place to identify contacts to prevent those new outbreaks. So if we have an outbreak among a workplace or some other type of venue or group, we have robust contact tracing that will help to get those people into isolation or quarantine. And we also have the ability to use our resources to test sites that might have an outbreak, such as a workplace, as previously mentioned. Our dashboard could move back to green if our COVID cases move to an average of less than 7 new cases per day, or 49 cases per 7-day period. But we're currently averaging about 10, with 70 cases in the past 7 days. So that's an opportunity for us to do a little bit better. COVID is still here. I think we need to remember that. And so some of our threats are that we're not identifying all contacts of cases, which could lead to a larger impact. And then, as predicted, our testing rates have fallen. It's been a little bit due to decrease in long-term care testing, and that's a good thing for long-term care in that they don't need to be tested as frequently because the cases there are very, very low. In fact, I believe there was a day last week when there were a total of 6 residents statewide that had a positive COVID test. So that's pretty unprecedented in our state. But what that does is when they decrease their serial testing is it starts to increase our positivity because we don't have as many people being tested in the pool. So it's really important that people still continue to show up for testing, especially if they believe they may have had an exposure or they've been in the community and there's the potential of community exposure. So those are just some of the bottom line things. There's some additional slides in there as well. And I'm going to stop sharing my screen and turn on my camera. And potentially give you a few more updates that aren't part of the slides. I could answer questions first if there are any from the data.
Does anybody have any questions of Ms. Swanson? If not, then you can continue on, Debbie.
Thank you. First of all, I want to thank the commissioners that have provided some feedback to us and to our staff on our vaccination efforts at the Alara Center. That's been greatly appreciated for those of you that have had some firsthand knowledge of how things are going there. Just a few other updates on activities that you have supported thus far. We did hire the school nurse for Larimore and Amaretto, and she started today. Her name is Katie Lingowski, so we're really excited about that. We also have 2 additional staff members for the jail nurse position and the other school nurse position that have had offers made, and one will be starting March 2nd and the other one we're waiting to hear back from. We'll also be, as part of the next tier in COVID vaccination, we'll be doing vaccinations at Grand Forks County Correctional Center. Congregate settings are the next in line, and those will be happening across the county the week of the 22nd of February. And our staff will assist with that effort because it is a very vulnerable population. We also have been notified that FEMA will reimburse 100% now instead of the usual 75%, and that will include vaccination efforts. So we're trying to ensure that we collect as much information as possible about all of our vaccination efforts on the city side, and would recommend that the county do the same wherever you have an investment in vaccination so that you can request that FEMA reimbursement. And I believe the information has been provided to the appropriate people within the county. And then lastly, I want to go back a little bit to the issue of vaccinations and how we're doing a little bit of outreach and working with our partners to ensure that we have equity of vaccine distribution in the rural parts of Grand Forks County. We're monitoring the rate of people that have been vaccinated that are 75 and older through our immunization registry. And we've achieved about 50% coverage there, and about 40% coverage for people ages 65 to 74. So we know that's not herd immunity, and we have some work to do, and we anticipate that that group will be the greatest at taking vaccines because they have a lot of history with vaccine preventable diseases. But we think that there may be people that are experiencing some barriers. So a couple things we're doing are working with Northwood Deaconess Health Center to ensure that they have enough vaccines supplied in their primary care clinic, as well as Spectra Health. They have primary care clinic in Larimore. And then also the Grand Forks Senior Center did a little bit of outreach to residents of Grand Forks County that their social workers were aware of, that maybe were receiving home delivered meals or other services, and did a little bit of quality research to find out what some of the barriers were. And as we expected, some would like to speak with their primary care physician. Some have transportation barriers. Some are just vaccine hesitant, and they want to wait a while before accepting the vaccine. So we know we have some work to do to address some of those barriers to make sure that we're being equitable across the county as well as within the city. And so I'm happy to answer any questions that any members of the commission may have regarding my list of updates there.
Anyone have any questions for Debbie?
Madam Chair, this is Tom. I've got just one. Ms. Swanson, I saw today where the federal government is going to increase the amount of vaccine up to 13.5 million doses a week, which is a 23% increase. Assuming that we get approximately that 23% increase next week or the week after, as soon as it gets in the pipeline, are you going to be able to handle that much of an increase with your staff?
Commissioner Falk, members of the commission, that's a really good question. I think it would depend on what they're counting as the 23% increase. We know that they have released doses to the Federal Pharmacy Partnership, and in Grand Forks that would go to Thrifty White Pharmacy. And then also they are releasing doses to federally qualified health centers, which Spectra Health is a FQHC in Grand Forks County. So if the 23% comprises additional doses going to them, we know that they have plans to vaccinate within the priority tiers. But if it is above and beyond that, we would want to increase our capacity both at the Alaris Center for our community clinics, but also across all of our partners that can reach our vulnerable populations. And that would be a decision that we would make. We meet Thursday mornings with all of our vaccination and testing partners, and that would be something that we would discuss with that group.
Thank
Um,
Madam Chair?
yes, Commissioner Eglin.
Ms. Swanson, how many vaccination sites are presently operating in Grand Forks County, and what is the total that you could have if we had sufficient vaccine?
Commissioner Ing and members of the commission, that's a really good question. There are 22 sites listed for Grand Forks County, but currently the vaccine has been allocated to a partnership with one main site along with the rural sites, which are Spectra and Northwood Deaconess. Additionally, now next week, we'll be doing those congregate settings, so that's more. But I would suspect that if we employed all 22 sites across the county, we could deliver a lot of vaccine in a lot of really creative ways. We also would want to look at using what resources we have to really invest in that really creative outreach, which might include things like home visits to people who are homebound, both in the city and the county, through some private providers that could do that work. And then also we could move faster down in the tiers, which would get us through 1B and into 1C, where we have a lot of essential workers that could be reached in their workplaces. So I don't have an estimate per se, but I do believe that if we receive significantly more vaccine, there would be a lot more activity across all of the 22 sites that it would be available.
But at the present time, is it just the Alaris site in Grand Forks? There must be a lot of people who have transportation issues in Grand Forks and surrounding area around Grand Forks. Is it just the Alaris Center for now?
Commissioner Ingen, yes, that is the current plan in the city of Grand Forks, is at the Alaris Center. But once again, as I mentioned before, with additional doses next week, we'll be at congregate settings, and then providers are doing that, vaccinating in the congregate settings, as well as the Thrifty White Pharmacy, and then the FQHC Spectra Health, if they get additional doses directly from the federal government. That hasn't been confirmed yet. But you are correct that the main vaccination site is the partnership between Public Health, Altru, and the city at the Alaris Center. And yes, we do have people that have transportation issues. We've addressed that with cities, area transit, and bus transportation in the city of Grand Forks, but I fully recognize that that is a challenge for people that live in the county. And thus, that's why the senior center has engaged their outreach workers to find out about some of those transportation issues. And it's very likely that we may need to address that with going to the people where they are.
Sure. Thank you.
I probably should let the rest of the commissioners know on the Wednesday leadership calls that we have. I have, on behalf of the commission, thanked Ms. Swanson and her staff for the remarkable job that they have done. I have heard a lot of comments, both from rural residents in Grand Forks County, as well as those living in the city of Grand Forks, on how efficient and how effective the immunization site has been. Some have needed a wheelchair, some have needed assistance, and there's always somebody there to do that. The line flows very quickly, and they've really been very appreciative. I believe the Grand Forks Herald had a letter to the editor recently on someone who is very happy with the experience. So I have continued to thank Debbie and her staff for all the hard work that they have done, as well as the volunteers and individuals coming in to help out. It's been very effective. And yes, we do need to work on getting more shots or more vaccinations out to the rural communities. Spectra Health will be a help. The Northwood Deaconess Center, I think, will be a help. At least we're getting 2 medical facilities that are 25 miles out of Grand Forks, and it's kind of the center point of the county. So hopefully that will be a little bit more efficient or more effective in people being able, if they are homebound, getting a ride or having an opportunity to get to those facilities to get a vaccination. Any other questions for Debbie? Anything else you'd like to report at this time, Debbie?
I don't have anything else. Thank you very much, Madam Chair and members of the Commission, for the opportunity to provide the update.
Okay, well, thank you very much for the information. The next item on the agenda is emergency management. Carice, are you with us?
I am, Madam Chair. Good afternoon.
Good afternoon.
I have two things for the commission tonight. One of them is info only and the other one will likely require some action. In your packets, you have two staff reports. The first one will be the DES command package. It's a combination big pickup truck with a incident command trailer attached to it. Former President, there we go, Bob, I just promoted you. Former Sheriff Rost had an agreement with DES and he had been storing that package out at, I believe it's Waterworld. But the department is growing and so the current sheriff has asked for that package to be moved. Now, there's only 4 in the state, and so we were very reluctant to let that package go back to Bismarck, because if we did, we would have to rely on Fargo to bring up a command trailer if we needed it. And since we don't have ours anymore at emergency management, it just amplified the need for keeping it here. So I reached out to Tom Ford, and he was able to help broker a deal with the Air Force Base. And tomorrow at about 1 o'clock, we will be escorting the command package out to the Air Force Base. They'll be storing it for us in a heated hangar, meeting all of the nuances that DES needed. There will be an MOU that'll be put in place with State Department of Emergency Services and the Air Force Base for temporary storage. And we're working on access for some of their staff members to get to that if they need to, because it is a deployable asset throughout the state if they do need to move it. And then after, I believe Tom told me there's a building being built at Grand Sky, and we are hopeful that once that building is completed, we'll move the package again to the private side of the fence, which will make access a little bit easier. But the base has been incredibly gracious and very accommodating in helping us get this done. And I'm hopeful that we'll be able to move it tomorrow and that part of it will be done. So if there's any questions on that, I am open to try and answer them.
Are there any questions of the parties for this particular information? Well, the good information, the positive is that we're still maintaining that particular equipment. And I don't think it's a bad thing that'll be out at the base or at Grand Sky in the future. Anybody have any questions? Okay, then continue on, ma'am.
Okay, the last one I have for the good of the board is the closure of county property. Last March, in the midst of the heightened COVID infections, the board made a motion to close the fairgrounds and the surrounding property, and any use of that property required a safety plan be submitted for review to myself and public health, and then presented to the board for approval. I've been contacted by a couple of county staff, mostly the 4-H program right now. They're trying to plan their spring curriculum, which will likely get kicked off in May. And they're wondering whether or not they still need to do a safety plan and whether or not the same restrictions are in place. So trying to get ahead of that, I had a conversation with Commissioner Knopf, and we thought that it's best to just bring it to the board's attention and see what you would like to do moving forward.
Okay, so one of the items, or the item that we need to discuss and make a determination, is if we would choose to continue to keep the Grand Forks County Fairgrounds and surrounding property closed, or if we are looking at a different plan for upcoming events as we move forward. Comments by commissioners?
The only comment that I'd make, Madam Chair,
Yes.
would be that, you know, we also have the carts and we have the Speedway. And so we have 3 entities out on the fairgrounds that this is going to affect. And so we need to be, I think, consistent in the application of this, the decision that we make. So, you know, it's more than 4-H, or it could be more than 4-H. I guess I'll put it that way, depending upon
Derek?
what the.
And at this time, I'm assuming that the River City Speedway is planning on continuing with racing this summer. Is that correct, Diane?
Yes, they have. I've listened to radio interviews and things like that, and they are planning a bigger and better program this year. I think maybe a few more weeks of extending. I can't say this with 100% certainty because I didn't hear it all, but my understanding it was more programs and they were bigger and better, and so they're looking forward to having a robust summer.
Okay. Other comments that commissioners would like to make?
Madam Chair, this is Dave.
Yes, Commissioner Engen.
Whoops. Yeah, I thought I was on mute there. Question for Kari. Is it a little early to simply decide we're not going to have those restrictions? Or do we leave it as it is with the idea that we hope to be able to open it up more? Or how do you see it?
Chair Engen, members of the commission, that's, to quote Debbie, that's a very good question. We don't have the crystal ball, you know, we've got the new variants, we've got panic and fear, we've got all sorts of things in the mix here. And there's no easy answer. I mean, if we open it up, if you guys make a motion to open the fairgrounds, everybody's going to move forward with their contracts, you know, with their advertising, with their investment in their events. And if we get a spike, we're going to end up having to close it. So it's a very difficult thing to maneuver. I don't think, judging from what I've heard through radio and ads and stuff, I don't think people remember that the fairgrounds is still closed. I think they believe with COVID fatigue that everything is kind of back to normal. Our numbers are low, our infection rate is bumpy, but it's not what it was. I've seen that many don't even remember we have a mask mandate in place. So, but to Commissioner Knopf's comments, you know, if they are indeed planning, you know, for bigger and better shows, you know, it'll be an uphill battle all the way. So I've reached out to my counterpart at the Department of Health. We're trying to come up with some sort of plan that would have triggers involved that would make it easier. That if we reach, you know, using the dashboard, if we reach certain numbers or certain colors, the commission can say this is our trigger and this is when we're going to close the fairgrounds. Something that the public can track themselves, something that isn't so focused on a decision, but something that they can look at and be cognizant of. You know, we still need to have the safety measures in place. We still have a mask order in place. I don't know that that's going to be lifted by summer. It's all going to be dependent on the numbers and the vaccine. I think Debbie said 60% was kind of the target for herd immunity, but I don't know that we're going to be there by the time these events begin. So that's a long-winded way of not answering your question, Commissioner Engen.
Well, it does answer the question, though, in many ways. What's the latest point where we could put out information that people would be able to rely on? Is it the middle of March, or should we be doing something now? Everyone who's doing a contract, and we've done some up here for the acts that we're going to come in and so on, there's going to be a clause in there that's kind of a COVID clause. If things shut down and there isn't sufficient space to have someone in the auditorium, for example, then the contract is cancelable. So they may have to put in protection clauses like that. But we want to be able to let people, you know, plan these big events too. So when should we be doing this? Middle of March, should we be able to give a good idea, or when do you think we could?
Commissioner Knopf, you're on the Fair Board, and I know that you've advised them to do COVID clauses with their vendors and, you know, their rides and things. When do they start entering into contracts?
They've been entering into contracts, I can't give you an exact date, but, it's been, a month or two, and, it's been very clear, that there is a way out as a result of COVID, and the people that they are contracting with, the carnivals people, the vendors, that sort of thing, all have been, to my understanding, very decent about it. They all understand they're going through this same thing with other communities where they hold fairs or have a carnival, that sort of thing. And so what they've done for the fair board is that, because last year we had contracts in place already, fair didn't happen. And so what the carnival people did, and some of the vendors, the music, entertainment, that sort of thing, rolled over the contract into this year. And so, and most of them were without an increase, how you sometimes have an increase, prices go up every year, but rolled it over without an increase, and, established timeframes and things like that. And so my understanding is that the contracts that have entered into, and the communications that they have had, that the vendors, the entertainers, the carnival are indicating that that same process would happen, where everything that's been planned will just roll over to then 2022. And so, like I say, the carnival, the vendors, the entertainers have all been very decent there. It's not just us that they are experiencing this with. And so, it's across the board. And so, but they have to plan, because everybody's on a circuit. And if you don't get, your plans out there and reservations made, that sort of thing, it gets more and more difficult to find your entertainment and that sort of thing. And so they've done a great job putting that together, planning, and they've done it with the understanding that it's subject to change. And I guess the communications I've had with them is, you need to continue planning. We can't say yes or no at this point. Nobody knows. It's things can change tomorrow, and so, and they know that, and they understand it. It's disappointing, but that's where we are right now. And so, they can do that. I'm not sure about the carts people, and I'm not sure how that works with the Speedway, as far as their planning, but, they too put that information out so the people that are on the racing circuit can make their plans. But again, that's not something that they haven't been exposed to. And when I'm talking I'm not talking necessarily the Speedway, but the people that are on the racing circuit. It isn't just us that were not opening up or had, restrictions. And so, and so all I, to me, to have the plan in place is still good, because we're not out of the water yet. But I had told Kari that, a plan doesn't do us any good if people aren't going to follow it or enforce it. So to me, that's a big consideration. And so, otherwise, what's the point? And so I don't know what your thoughts are on that, but it's something to think about. But, also with those safety plans, Kari, and I don't have them in front of me, but most of them had all of the safety requirements, the restrictions, that sort of thing in the plan, correct?
Correct.
And those
Following
are all
the North Dakota Restart guidelines, most of them. Yes.
And so nothing has really changed with that, have they? I mean, the restrictions on occupancy and things like that go up and down. But, you know, so we couldn't be specific. Well, we could be specific about it if we so choose. But you know, it's still the hand washing, it's still the face masks, it's still the distancing, all of those sorts of things. You know, and those are all in the safety plan. So I don't see a point in lifting the safety plan at this point if those are requirements anyhow. You know, and it is in place. And
Well, the occupancy has changed a little bit, but
Yeah.
when I went back to look at the updated plans, there is absolutely zero information when it comes to outdoor venues. So you can look at large gatherings, but those plans are geared toward being indoors.
yeah, but they are, but then you can take the distancing and add to that. And so,
Absolutely.
yeah, so, okay, we aren't going to tell you how many people you can have, but you do have to distance 6 feet,
Correct.
right?
So
I
those
mean,
are the kinds of things that we would have to adopt as a board. What are those guidelines going to be? And because there isn't any, you know, and we didn't adopt state guidelines hook, line, and sinker. We used our local public health recommendations also. But yes, I think a reminder that the fairgrounds is still closed and there's still requirements in place. And then, you know, I'd have to defer to Commissioner Rost. I don't know exactly when the first race is. I don't know when the track opens.
I think it's in May.
Yeah, it's April.
So,
Okay. So then Commissioner Engen, I would say by mid-March, no later than mid-March, we should have something out there.
Kari, would
Yeah.
it make sense? Oh, go ahead, Commissioner Falk.
Yeah, thank you, Madam Chair. You know, I'm going to say this, and I'm optimistic that things are turning around for us. We have quite a few people who have had the disease and have some immunity, and our vaccination program is really the best in the country right now. So we're making a move. However, I think we need to put this off till the middle of March, because everything that you read, the new variants of COVID are out there, and some predictions are that March is going to be a very difficult month. If that's true, then that's going to give us an indication of the problems we're going to have at least during the spring. If that doesn't hold to be true, then I think we'll have a better idea of how we can open up or what guidelines we need to have as far as opening up. But I think it's just a little too early right now with some of the concerns that medical people nationwide are having. Thank
so
you.
does that mean, Tom, then that you would support, I guess what I had indicated is that leave it in place at this point and
Yeah.
we'll revisit it.
Exactly, because I don't think we have enough information or data at this point. And I think that hopefully is going to change in a month. I mean, at least give us some indication. If we're continuing along at the pace we're going, then that's very positive, you know, even if it's nationally, there are some problems, but I think we should know by our middle March meeting. I hate kicking the can down the road, you know, but that's kind of, I think that's what we have to do to be safe.
Well, we have to follow the science. So I think that that's exactly what we would be doing, to wait and see.
Yeah.
That new variant is here. It's in 47 states. So let's just see what it does and make a decision based on that.
And if it's anything like the last one, you know, we were in the middle of the United States and kind of the last to have the spikes, you know, with that. And so I guess the longer that we have, the better. But I would make a motion that we table this until, or that I would make a motion that things remain, the safety plans remain in motion, in place and to be reviewed at a later date, possibly the end of March or so.
I don't think we even need a motion on that.
Okay, and that's fine. That's
But
fine.
what I would suggest is that the second meeting in March, I think it would make sense to ask Kari to come with some recommendations. Some ideas, talking with public health, talking with others, to come up with something that would make sense that's following CDC guidelines, that we're looking at, you know, what our rates are at that point of vaccination, and come to us the second meeting in March with some type of recommendation, so that at least we have something to start with, a starting point, instead of trying to come up with something during our commission meeting. Does that make sense to everyone?
Madam Chair, it certainly does. And I would hope that the organizations that want to have events out there would come up with some plans also and with alternatives. And I don't want to drop all this on Kari, but they should have some plans and what they're going to do if our cases spike or whatever. So maybe they can work together.
Well, and certainly they could reach out to other venues that are struggling with the same thing, whether they're in state or out of state, depending on what kind of event they're planning or looking at for the summer of 2021. Does that make sense to you, Kari?
It certainly does, Madam Chair.
Madam Chair, and maybe the governor, in his infinite wisdom, would make a recommendation to outdoor events as far as how they can be, how people could attend. He hasn't dealt with that at all, and see where that goes. Maybe he'll have something by March.
That certainly would be helpful, I think, for people looking at plans for the summer of 2021.
Maybe Kari could reach out to the governor's office.
Actually, Commissioner Rost, I will work with my counterpart at Public Health and we'll reach out to the State Department of Health and DES just to see if there's any plan for putting some sort of outdoor guidance together for larger outdoor venues. I know with the city, they're not doing.
It's not going to be the only outdoor event that he's going to get pressure from in the state.
Nope, absolutely not.
Certainly. Well, thank you very much. Do you have anything else, Kari?
No, ma'am, that was it.
Okay, thank you very much for bringing these forward. And now we'll move on to highway engineer. Mr. West, are you available? Are you present?
I am, Madam Chair. Can you hear me?
Yeah. If you could speak a little louder, get a little closer
Okay.
to the microphone, that might be helpful.
How's that? Is that better?
Better, yes.
Okay. Well, I have a couple items for the board to consider today. The first item is we have 2 box culverts, bridge replacements in Grace Township with the bridge bundling grant, and the project was bid on February 5th. Right in front of you is the results of the bid. We had a lot of attention on there and some very good bids. Riley Brothers Construction was the low bid. They are a reputable contractor, and I would entertain a motion to accept them as the contractor and sign the resolution to accept them as a contractor. Now, just so the board is aware that Walsh County has signed their own resolution and will pay their own portion of the contract.
But using the same contractor, correct?
Yes, the same contractor. That was the point of the grant, was to lump multiple projects into one contract and take advantage of economy of scale.
Okay.
Yep. So that's correct.
Do any commissioners have any questions at this point? If not, does someone want to make a motion on accepting the Riley Brothers Construction for the as the accepted bidder for the culverts and for the projects sharing with Walsh County?
Madam Chair, Commissioner Ross, I would make that motion.
Okay, is there a second to the motion?
I'll second that motion.
Okay, thank you, Commissioner Knopf. Any discussion? Does anybody want to bring anything up?
Madam Chair, this is Dave.
Yes,
I think we have to put in the motion this signing by the chair and the resolution.
Resolution.
Resolution's on page 60 of our packet. So if they use that and have the auditor and chair sign, then we're good.
okay, with signatures, are you okay with that? The two that have made the motion and seconded it?
I am.
I am.
Okay, anything else? Then assuming a roll call vote, all those in favor of the motion signify by saying aye.
I,
Opposed, same sign. The motion is carried.
Thank you,
Please
Commissioners.
continue on, Mr. West.
Thank you. The second item I have is the contract with North Dakota Department of Emergency Services and FEMA for event 4565. That's last summer, that June 30th, July 1st flood we have. This is, the contract for us to get reimbursement funds for the flood damage for Grand Forks County and our associated townships. I would ask approval of the contract and signatures on page 16. I already did fill in the information on page 14.
Okay, are there any questions by commissioners? If not, you want to move forward with the motion?
I'll move approval. This is Dave.
Okay, is there a second to the motion?
I'll second it, Tom.
All right, then any questions? If there are no questions, assuming a roll call vote, all those in favor of the motion signify by saying aye.
Aye.
Opposed, same sign. The motion is carried. Anything else at this time, Mr. West?
No, that is all I have. Any other questions for the Highway Department?
I don't think so. Maybe unless you want to take some equipment down to Texas. Texas or Oklahoma could probably use a little bit of help at this point.
Yeah.
Not good.
Yeah.
Well, we just all hope for their safety. Okay, well, thank you very much, Mr. West. It's very good to see you, and we appreciate everything that you brought to the commission. The next item is Director of Administration, Mr. Ford.
Yes, Madam Chair, members of the commission, thank you. Good afternoon. I only have one quick item, and it's the Icon remodel project for the courthouse, the State's Attorney's Office, Social Services area, Public Health area, and First Floor South. As you know, the bid opening will be February 18th at 2 o'clock. And I would like to, in bringing this up with Ms. Peach earlier, I would like to ask that the commission consider a special meeting either next Monday or Tuesday. And I think Ms. Nelson has this figured out as well. Just so that the board can approve a recommended contractor so we can get the project started right away instead of waiting until the next March commission meeting.
Okay, in looking at those bids, does anyone, and Debbie can work on trying to figure out either Monday or Tuesday a time frame that would work. Does anybody on the commission not available at all on Monday or Tuesday of next week? I'm assuming it will not be a very long meeting. We will probably add on not only this bid opening, but another item. And I can bring that up during my committee assignment or reports. So Debbie will be contacting us, and we will make sure that we have a special commission meeting next Monday or Tuesday to address the bid opening, Mr. Ford.
Very good. Madam Chair, that is all I have for tonight.
Okay, are there any questions of Mr. Ford? If not, then we will move forward to the state's attorney, Ms. Wamstead.
Madam Chair, members of the commission, I have nothing to report today. Thank you.
Okay, thank you very much. I do want to make a comment, though. Well, I could save it for later, but there was a lot of the state's attorney office has been doing a lot of work on children that are in need of adoption and those that need placement, and our foster care numbers are actually down in Grand Forks County. So that's good. That's good to see that the children are being reunited with their families, as well as children are being adopted. So Ms. Wamstead, thank you very much to your staff for all the hard work that they have done in doing this. I know it's a great deal of paperwork and it's a long process, but it's very excited to be hearing that from the zone board.
Thank you, Commissioner Peach. I will definitely pass that along, and your comments are very much appreciated.
You're very welcome. Well, thank you to your staff for all the hard work that they're doing. Okay, then let's move on to committee reports. Commissioner Engen, we will start with you.
Okay, did all the members on the commission receive the emails with my attachments yesterday about NDHC? Because that'll speed it up if you did.
Yes.
Okay, good. There's no liability in the county. The county and the city and places like that will just be asked to say, we think it's a good project. It's very helpful for the area to have the hospital and nursing home and all of that essentially rebuilt. It's going to be a major project. It's well underway. Commissioner Peach is on the board, so she knows all about it. And Northwood has served as an overflow for Altru on occasion, because we do have a hospital, have a nursing home as well, and a very good therapy department and all kinds of things. So what Pete Antonson, the CEO, is requesting is that we as a county commission give approval or just recognize that this would be a good project, the certification of significant community support. There's going to be a public meeting on March 8th, and this statement of support has to be signed on or after that date, probably the 9th. So we could approve this and leave it for Chair Peach to sign on the 9th, and anyone who wanted to go attend the public meeting, of course, could run out to Northwood for a good time one evening. But that's really all, unless there are some questions. We could have Pete Antonson come on Zoom in our next meeting. It'd be before that public meeting. So if you have questions that you would like to ask him, we could bring him along. So, any thoughts?
One of the things that I did share with Commissioner Engen, because I am on the board for the Northwood Deaconess Health Center, it's through my church because it's a faith-based organization. I will recuse myself from any voting. If you do have any direct questions, I can certainly answer them as a board member. I also would recuse myself from signing the letter. I don't want there to be any conflict of interest. So I would ask the second chair to sign that, which would be Commissioner Falk, so that there's no documentation of as a board member for Northwood Deaconess Health Center. And I'm also on the Grand Forks County Commission. I do not want that conflict of interest to exist. So I'm just sharing that information with you up front. So what are the wishes of the board at this time?
Well, Madam Chair, this is Dave.
Yes.
I should also, I put it in my email, but as a matter of full disclosure, my wife is on the board of NDHC with Cindy. So, Ms. State's Attorney, should I recuse myself from this one as well, do you think?
Commissioner Engen, members of the commission, I don't think that is required, but if it's something you're more comfortable with to avoid the appearance of impropriety, I think you certainly could in your discretion.
All right, then I think I will do that as well.
Okay, and for the rest of the commission members, commissioners that would be bringing forward a motion, do you choose to do that today, or would you prefer to wait until the first meeting in March?
Madam Chair, this is Tom. I would move that we sign the letter of support for the project with the Northwood Hospital.
I second it.
Okay, there is a motion and a second. Any discussion? If there is no discussion, assuming a roll call vote, all those in favor of the motion signify by saying aye.
Aye.
Okay, the motion is carried. So once that public meeting is held, Ms. Nelson will be getting a hold of Commissioner Falk to have him sign that letter. And Dave, that may be, I'm assuming that would be available possibly for Commissioner Falk. Do we have to wait until after the public hearing?
Yeah, it says on the memo from the CEO, Pete Atkinson, that it cannot be dated until after the public meeting, which is held on Monday, March 8th. So it should be signed and dated on the 9th or after.
Okay,
That'll be
well,
fine. That'll be fine.
please share that information with Mr. Atkinson.
I will.
That would be appreciated. Anything else to report on Commissioner Engen?
No, thank you. That's all.
Okay, thank you very much. Next, we'll go to Commissioner Falk.
I went to a meeting with the mayor, is coordinating a visit by the Chief of Staff of the Air Force here the first part of next week, which is certainly a very positive for our base. And other than that, nothing else.
Okay, and I'm sure you will represent us very well. Any questions of Commissioner Falk? If not, then Commissioner Knopf.
A few things. I had an emergency management board meeting on February 8th. Good meeting, good discussion. There are 8 or 9 topics, 2 of which were discussed today. One was in Kari's report, and then the other one was the board appointments. And so, and then I currently am attending library board training that's being provided by the State Library Association in Bismarck. And this is a series of 8 1/2-hour trainings twice a week. And that goes from February 9th through March 4th. Topics are trustee training, overview of governance, library ethics, budget and finance planning policies, human resources, and advocacy. So completed 3 of the 8 thus far and challenged the other library board members to attend. And if they show up for all of the trainings, I will buy them a box of chippers. So anyhow, we'll see where that goes. But it's excellent training, and it would tie in with any person that is a board member of any entity. So it's been very good. Fair Board met on February 10th. Planning continues for the fair, which is held the week of June 23rd through the 27th. And they're just wrapping up all their contracts for scheduled events and that sort of thing. And they currently are in the talking stages with a firm by the name of KO Architects out of Des Moines, Iowa. And this firm specializes in fairground architectural design and will work with the Fair Board to help identify wants and needs for the fairgrounds. And KO has indicated that they will come to Grand Forks to physically see the grounds, meet the board sometime early this summer. And this process will better enable them as architects to provide drawings and materials that can be used by the Fair Board for fundraising purposes. And so just to give you a heads up on where that is. And, you know, and the thought that comes to mind is that if there is new fundraising, or there is fundraising for new buildings to be put on the properties that are owned by the county, does that all have to be approved by us? I would think it would. But Haley, if you have any thoughts on that or want to give it some thought and get back to me, that would be great. And they currently have The Fair Board currently has 3 unfilled board positions and are seeking recommendations. And at the suggestion of Terry Stromset, Kari has been invited to attend some future meetings to see if this might be something that she's interested in. And I guess I have a question for you, Ms. Wamstead. Again, is do those appointments, like other weed board, water board, all of them, where they have appointments that go before the commission for approval, do we need to do that for Fair Board as well? And so again, I don't need an answer right now, but if you want to do some research on that, but I started thinking about, oh, well, what's different with them, with that board versus the other 2 boards. And so, they all get public funding, through the county. And so I just wanted to get clarification on that so I can share that with them so that we're all going in the same direction, communicating the same thing. And then the other thing was the inquiry on the COVID restart or the plan, and we've already talked about that. And then on February 10th, I attended a local emergency planning committee meeting, also known as the LAPC group. And that's a community-based stakeholders group of professionals that are tasked with emergency plan development and emergency response in our community. And so it was a great meeting, a lot of very dedicated members that belong to that. And so I just want to thank Kari for allowing me to sit in on that meeting. It was very, very good. Library meeting, board meeting is the 17th, tomorrow. And then on the 19th, there's a FEMA webinar that I will participate in with respect to national preparedness on COVID-19 vaccine support. So I'll have more on that later. So that's all I have.
Okay, are there any questions of Commissioner Falk? Or Commissioner Knopf, sorry, I apologize.
Ask Commissioner Falk the question.
And before I go on to Commissioner Ross, I would be remiss if I didn't say that the meetings coming up this week with the officials of the Air Force Base, Mr. Ford will also be attending with Commissioner Falk. So there will be 2 representing the county at those meetings. I didn't want him to feel slighted that I was aware that he's also attending those meetings. Commissioner Ross.
Just have an MPO meeting tomorrow at noon. We're gonna talk about the bridge crossing.
Where it will be, or just more discussion?
More discussion.
Okay.
More discussion. The other thing, Madam Chair, and I brought this up, you weren't at the last meeting, but anyway, I would like to have the county coroner's portfolio. That's not been assigned to anybody.
Oh, sure.
So I would like to have that because there are some needs that Dr. Sims needs and that she has talked about here in the past that, I would like to address some of those issues. So.
Okay, does anybody, is everybody in agreement with that Commissioner Ross would like to take on the county coroner's portfolio?
That'd be great.
If not, are you okay with that? Commissioner Falk, would you like that?
No, I'm just happy Bob's willing to do it. Thank you.
I'm just dying to do it, Commissioner Falk.
Oh,
Excellent. I like that. I was
That's
searching
bad,
for a
Bob.
comment like that, Bob.
Well, we will certainly give you that, I will certainly give you that portfolio assignment, and we'll add that to our list of portfolios. Thank you very much for coming forward and with a willingness to do that, because the work that Dr. Sens and her staff does is very important. And I'm always impressed when there is an issue, sometimes in Northwest Minnesota or a different county, where it actually comes to Grand Forks County. Particularly instead of sending it, say, from Polk County, Kirkston, up to Ramsey County in the cities. So yes, great suggestion thank you very much for making that comment and the commitment. And I'm sure Dr. Sens will appreciate that. Anything else to report, Commissioner Ross?
No, ma'am.
Okay.
Madam
and-
Chair,
Yes.
can I just ask a question, please, relating to the
Certainly.
bridge? You know, I think we probably all recently just received a couple emails from, I think they came from the chamber regarding, and maybe it was the MPO, I'm not sure, regarding a meeting that's coming up relating to the bridge.
Yes,
Has everybody else gotten that?
No.
you haven't got it. Could you?
I get my MPO.
Could you forward that to Ms. Nelson and she can make sure the rest of the commissioners do receive that email, Diane?
Well, and I got it. And so I was thinking that maybe the chamber still has me as the chair and technically Cindy should be invited to that because, but I didn't know if everybody got it or not. And so, but I think that meeting is soon. So
Okay.
I'll send it to Miss Nelson and I'll also send it to the chair. And
Thank you.
then you'll have it as soon as possible. I'll do that yet this evening. So
Thank you. That
Yep.
is very much appreciated. Any other questions of Commissioner Ross? If not, the Social Services Zone Board meeting was held this afternoon. You'll see that correspondence, the Human Service Zone Plan was approved. So that was a good thing. There is a Senate bill on the floor that is, or at the legislature that's dealing with the zone board. It's not 100 pages like it was 2 years ago. It's very minimal. Scott reported to us today. Actually, we had a fairly short meeting. The zone board seems to be moving forward as planned. The budget is in line as planned. The only thing that tends to be a question, and I believe that has been something we have discussed previously, is the cost of paying for funerals of county members. And so I believe that the state was taking a look at that, particularly when our state has had a number of individuals that have passed away that may have been in nursing homes, elder care facilities, those that families could not afford a funeral. And so our death numbers have been up, obviously, because of the pandemic. And so the state is taking a look at that. But that we meet every month at 2:00 on the second Tuesday that we have commission meetings. The next Airport Authority Board meeting is a week from Thursday. Basically, numbers are coming back somewhat. There still isn't 100% capacity. They have added a couple more flights with Delta. We are seeing the numbers go up also for Las Vegas and Mesa, Arizona, coming from, what's that airline called? Allegiant, sorry, I apologize for that fault of mine. And so they are continuing to work on a third airline in the future, but right now it's not going well across the country, let's put it like that, or world for that matter, as far as air travel. So we are no different than any other airport across the country. The university is back with their numbers. They're not to full capacity either, but they have been flying with the students since, I want to say, about May of this last year. So they are doing quite a bit of traveling, and that numbers ticks up the number of takeoffs and landings at the Grand Forks Regional Airport. So that has made a difference. Any questions of my report? If there are no questions of my report, let's move on to unfinished and new business. The first thing is 12A, special assessment.
Madam Chairman, members of the commission, that's just to inform you that there will be a special assessment right outside on 4th Street here. And there is a public hearing that you could attend if you disagree with that.
Okay, and that will be on March 15th at 5:30.
Yes.
Wonderful. Thank you very much for that information. Next item is the Grand Forks County Township Officers Meeting. Is that going to be virtual or is that live?
Canceled.
Canceled. Okay, then we will be having no Township Officers Meeting this year. It's been canceled for 2021. Garrison Diversion Matching Recreation Grant Program. That is a letter that came to us telling us a reminder of that particular meeting or that particular grant program that's available. If you know anyone who is interested in applying, please note that the application has to be postmarked by April 1st of 2021. They will have another project later on, but this is the one that's coming up very soon. So if you know of any park districts or groups that are interested in applying, please share that information with them. And the last thing on the correspondence agenda is the Grand Forks City Tax Incentive Projects. And that is notifying us that the meeting on February 1st was a public hearing on 4 tax incentive projects, and they voted unanimously to approve all 4. And I believe they came to us and they presented on that at the 2 meetings ago. So we are fully informed about what is going on with those. All right, does anybody have anything else for the good of the order? If not, may I have a motion to adjourn the meeting?
Madam Chair, so moved.
And a second.
Second.
Assuming a roll call vote, all those in favor of the motion signify by saying aye.
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 Opposed, same sign. All right, our